This is episode 49 of the Women in Depth podcast. The information found in this podcast is not a substitute for help from a licensed mental health professional. Hi, and welcome back to Women in Depth. I'm your host, Dr. Lourdes Viado. I'm very excited to bring you today's episode because we're going to be talking about an intersection between two very specific areas that there are a lot of questions about, that are not fully understood, and that it is beneficial and helpful to have more dialogue about. And these areas are the areas of hypnotherapy and trauma. Specifically, we're going to be talking about hypnotherapy as an approach for inner child healing. The inner child being an aspect of the individual that is wounded as a result of childhood trauma. Today, Dr. Elizabeth Bonet will be our tour guide as she sheds light on how we can use hypnotherapy as a tool for healing the inner child. Dr. Elizabeth Bonet is a certified hypnotherapist with a PhD in clinical psychology. While her main specialties are hypnosis and anxiety, she also works with couples. She's Gottman Level 1 certified and is PSI certified to work with perinatal mood disorders. She has been a yoga teacher for over 15 years and was the founder of the award-winning Yogafairy Prenatal Yoga. She won the 2014 Top 100 Leading Moms in Business Award, grew an international community of mothers, and ran the company for close to 15 years before selling in 2016. The prenatal yoga classes she created have been repeatedly featured in the Sun-Sentinel and the Miami Herald. Dr. Bonet is the author of 3 books: There Goes the Brainstem, Tales from the Trenches of Early Motherhood, Birth Stories from the Yogafairy, Real Tales of Birth from Yogafairy Mamas, and Your Marriage Can Change Overnight. She also has her own podcast, Hypnotize Me, which she launched in December 2016, and within weeks reached over 1,000 downloads. Hypnotize Me is about hypnosis, transformation, and healing. Dr. Bonet is a board member of the Florida Society of Clinical Hypnosis, a member of the American Society of Clinical Hypnosis, and a founding member of the South Florida Women's Health Alliance. Hi, Dr. Liz, and welcome to the podcast.
Hi, Lourdes. I'm happy to be here.
I'm very excited that we're finally having this conversation. Mm-hmm. It's been quite a scheduling process, so thank you for being here and for your patience. You know, I wanted to start off by asking you how you were drawn into the field of hypnosis.
I have been fascinated by hypnosis for a really long time. So I'm also a yoga teacher, and I taught yoga for many, many years before I became a psychotherapist. And you use a lot of meditation and very similar process to hypnosis at the end of a class often. I taught prenatal yoga, so it was often visualizations and walking downstairs and doing all kinds of things, meeting our babies, those kinds of things. So I was drawn to it, and I had used some hypnosis for my own kids and just bought them off a website that I thought looked good, and the guy sounded reputable. So that helped with my kids and their process. And then I just kept getting drawn to it. So it is quite a commitment. I practice in Florida, and you have to have 50 CEUs to be able to say publicly that you do hypnotherapy. So it took me about a year and a half or so to get those. It was quite a commitment, but I just knew immediately after the first training, it was a match. I loved it. It was just such a great match, and very similar to things I had already been doing when I was teaching yoga and doing guided meditations, those types of things.
That's interesting because when I was preparing for our interview, I was wondering, is there a similarity between meditation and hypnosis? Because I feel sometimes, when I'm meditating that I'm almost like in a trance state. And I wonder sometimes I wonder if this is similar or if there are parallels.
Absolutely. It is very similar to a meditative state. We all go into different brainwave states when we meditate. Hypnosis is very, very similar. The difference comes up more when you talk about meditation as a much more passive process in terms of all the thoughts are going in your head, right?
Right.
And that's the point there is to try to stop the chatter, to try to quiet the mind. Trauma even comes up during meditation for many people, and it's the goal there is to release that, to not focus on it, to bring your attention back to your breath. Obviously, there's all kinds of different meditation practices, but overall, that's generally the goal of meditation. Versus hypnosis is a very similar state, but it's much more active. And someone is leading you through, let's go through trauma if it's happening. Let's see what's happening and let's release it through an active process versus trying to push those thoughts away and focus on your breath. So it varies in that aspect when you're talking about that area. But it also varies in terms of when you're dealing with anxiety, you're teaching the system to self-soothe, but you're much more confronting fears, I would say, in hypnosis and working through them in an active way versus a more passive way in meditation.
So is there a difference between hypnosis and hypnotherapy?
I would say, well, it's really a technical term.
Okay.
So yeah, there's really not, but you can only say hypnotherapy or you're a hypnotherapist according to licensing laws in different states. So it depends on your degree and your education. So some states will say you can say that you're a hypnotist because let's say someone who doesn't have any degree, but they decide to go to a training to learn how to do hypnosis. They can often say they're a hypnotist versus a hypnotherapist is generally has a master's or doctorate level, is licensed in that state, even can practice as a medical doctor and call himself a hypnotherapist. So the terms are almost interchangeable, but you're really talking about training and process.
So, I know that there are a lot of these myths and misconceptions, but for you, what do you see as being, I guess, the biggest misconceptions that people have when it comes to hypnosis?
Oh, I would say, well, there's a lot of them. And I do these little mini episodes on my podcast that are like 2 to 5 minutes long where I try to address them. But I would say the biggest one is that it's a magic wand, that someone's going to come in, lay down on your couch, and you're going to talk and everything's going to be okay. Like everything's going to be healed. I would say that's the biggest one because the reality is that it takes more work than that. Like we have to have a conversation and get to know you some. And even if someone's coming in for something that's more simple, like smoking cessation, we still get to know you and see how do you process things visually, auditory, like what kind of processor are you? What are the motivations for changing here? Like, what are your individual motivations? And then most people are customizing the hypnosis to that person. So I would say that's the biggest one.
So that makes a lot of sense then, because you're creating a hypnosis script for them. And in order to make it really, I guess, aligned with the person, you do have to take that time to find out, to get those answers to some of those really deep questions, like motivations.
Yes, absolutely. And there are hypnosis files that you can download. Like there are some that, stop smoking, lose weight, all kinds of stuff that you can just download that they're not customized. And those can be effective. So I won't say they're not. They are for a lot of people. They're effective. But if you want to increase that effective rate, then you're really looking at custom hypnosis. So I think there's a difference there between the two processes. Does that make sense?
Yeah, it does. It absolutely makes sense. So I guess one question that, I think would be like a pretty basic question that most people would have is, does it work? Like, does hypnosis work? It's so simple.
Yeah, does
but
psychotherapy work?
Right. Because I think people aren't sure, and they just don't know. And so does it work? And how can you talk a little bit more about that? I don't know if that makes sense. Okay.
Well, yeah, totally. So it is a similar question to like, does therapy work?
Right,
it's
right.
like, okay, well, yeah, you can come in, we talk about your things, and we use hypnosis as a supportive tool for you to change your life, to change your thought patterns. And if you want to get into the neuroscience of it, it's to change the neural pathways in the brain is what we're doing. We're just etching those. Hypnosis helps to etch those a little deeper so that you can make that change. But it's individual for everybody. So if you want to look at research studies, a lot of the research depends on what you're talking about. But it's like, yeah, it works for this, this, and this, right?
Right.
But sometimes there's research studies that say, well, it's actually not so good for this. So I tend to base my answer to that question on the research and depending on what the person is coming in for. Because we know it's very effective for some things like headaches. Smoking cessation is one thing that it's incredibly effective for based on the research. Chronic pain, like these different things that have been very, very well researched. IBS, it's actually one of the best treatments, like better than medication, any medication on the market.
Wow.
Yeah, and that was researched for over 10 years. It's coming up on 20 years by Paulson out of the University of North Carolina Medical School. Like they're doing actual medical tests and getting tissue samples and all of this stuff to see, does this actually work? So it really depends on the question.
Well, I can see how, when you mentioned the neural pathways, it makes a lot of sense because really for shifting any behaviors in a meaningful way, that's what needs to happen,
Yes.
Yeah. And anything that can help the person with that, because it's really, really hard to do that, to make those changes.
Absolutely. Yeah. And it does have some kind of function on the autonomic nervous system that, we're not 100% clear about how that mechanism works, but we know that it does. So I know there's some neuroscientists out there who could explain it better than I am,
Right.
Just like if I asked my mechanic, like, how does a car work? Like he could tell me.
Right.
Exactly how it works. But do I really want to know that? No, I just want to know that, like, I'm going to take it in there, he's going to fix it up, and it's going to run, right?
Yeah, absolutely.
Yeah. Like, come on in. We will fix you up, and you're going to run. So
this next question might be one that we don't really go into because there are people who could explain it better, but I'm going to ask it anyway, just in case we can shed some light on it in a meaningful way. When we're talking about neural pathways, what are we talking about for those maybe who are listening who don't know, what we're referring to?
So that's a really good question. How do you explain neural pathways?
Okay, I'm going to try and you try too. How's that?
Okay, I will try. Here we go. So neural pathways are these connections that are made in the brain that we all make, and they develop throughout our lives. So when we have a really strong neural pathway, that's, let's say, a habit that we're doing or an action that we take that's really been reinforced, and we do it over and over and over again. And I wish I had like a visual of it, but I see it as like a deep groove in the brain.
Yeah.
Versus if you don't do something as much, the groove is much lighter.
Yeah.
So that's how I see like the hypnosis helps deepen those neural pathways when you're making change. So perhaps you want to make this groove a little bit lighter because it's not one that's very effective for you, but you're trying to grow and develop that new groove in the brain. Hypnosis helps you do that over there. It's like, let's go over here and develop a new path through the forest, right? This one is getting really, there's a lot of like thorns coming out and overgrown and prickly. And this path over here in the forest isn't that safe anymore. Why don't we cut us a new one that's safe and has some light coming through and feels good to walk down? So it helps do that. Does that make sense?
Yeah, it does. I like to use, I've been using the metaphor with my clients of the neural pathways that we've created are like, super highways with 6 lanes, and you can just drive on them really easily and really quickly. And you can get to your destination without even thinking, you're just like on autopilot. And then when we're trying to grow new pathways, these are like these roads that aren't even roads. They're like dirt roads, and they're not easy to travel. And, we really have to, it's uncomfortable moving down that road. So very similar like to your forest path, and so it's just a lot easier to get back on that super highway and just cruise to wherever you're going versus, versus going off the familiar, comfortable road into something that's off the beaten path that, just maybe is dark. It doesn't get to right where you want to get very easily. So just, that's kind of how I see the neural pathway thing.
Yes, I love that. I love the image of like zipping down the highway and there's no traffic there either. Traffic, right?
Yeah.
I love that.
Yeah.
And dirt road is more bumpy, but eventually if you use it enough, it gets smoother and smoother and you go faster and faster down that path.
Yeah. And then it becomes more like the highway. With the highway, you don't even have to think about it. I mean, you're just cruising. And then the new road is one that when you're first taking it, you have to be really mindful and cautious, and it might even be painful or uncomfortable,
Yes. Love that image.
Okay. So now we're going to shift gears. And, today what we're going to be talking about is the use of hypnosis in healing from trauma, and specifically healing the inner child. So what would you say would be a traumatic childhood? Because sometimes, when I sit down with clients, they do their initial paperwork, we get through maybe, half of our first meeting, and they will come in and say they haven't had any trauma. They haven't had a traumatic childhood. And later on when I maybe point out to them that something that happened or something that was ongoing was traumatic, sometimes it's hard for them to understand or believe that that was traumatic for them. So could you speak to that a little bit, Liz?
Yes, I'll try my best. So I have the same experience with clients often that they don't always perceive something as traumatic that perhaps we would define traumatic as a psychotherapist or a psychologist. And I think I also say most of the therapists I know tread very carefully there too. It's not like we want to change someone's perception if they feel like they had the happy childhood, let's say, right? We're not there to say, no, you didn't,
Right.
But it does become an exploration of, was something perhaps traumatic that you didn't initially realize or feel like it was, but yet it's still affecting your life in your current life, the life you're living now. So you have the trauma with the capital T's, right? Childhood abuse, physical, emotional, sexual. But then you have these more subtle traumas that often happen that are like neglect. Emotional abuse, I would say, is more subtle than an outright physical or sexual abuse. And they get combined in there too. So very rarely do you find physical abuse without emotional abuse going on as well. But often people won't identify emotional abuse until they get into adulthood, until they have their own kids often. And then they think and say, oh my gosh, like, no, that wasn't right. Then sometimes trauma will come up in their adult life that they really did not perceive as a child or even early 20s, depending on when they have their children. So I think about abuse or trauma like that. I know that some of the leaders in the field of trauma sometimes define like anything could be traumatic depending on how it's experienced.
Right.
And I think that is an important point to make. So something that perhaps one person doesn't perceive as traumatic, the other person could, depending on their own sensitivity and personality and what they needed as a child. So it's not like we're out to get their parents here or out to get their caregivers or whatever that is, but it's more a shift in you didn't get what you needed as a child. And being a mother myself, I know I have great compassion for parents It's like, you can't be 100% perfect, right?
Yeah,
Like,
right.
sometimes something is experienced as traumatic that you didn't even intend for it to be, like
Yes.
something like that. So those are what I call the smaller traumas, quote unquote smaller,
Right.
not to minimize them, but it's meaning that, those aren't the ones that are talked about on the news, right? Like those aren't the ones that a million articles are written about or very easily identified, but they're still held in a person, in their heart, in their body, and in their soul as they grow up.
Yeah, and I like that you mentioned that this is not about judging parents. I too have so much just respect for parents and the hard work of parenting. And I think it was Dr. Gabor Mate on Laura Reagan's Therapy Chat podcast who said that it's never about judging the parents or even saying that the parents didn't love their child. It's just understanding what that child experienced and how they perceived it and how it's affecting them in the present day.
Yes.
Yeah.
Absolutely. Yeah.
And I think too that, some of the sneakier ones, and I say sneaky because, someone could have had everything that they needed growing up. They didn't want for anything. And maybe parents were just busy and maybe they were occupied because of really valid reasons, however, that child grew up feeling like parents weren't there, even though the parent had to work, something like that. And so it's really even looking at how something like that can be traumatic for a child.
Yes, absolutely. Then that's a great example. Like often parents are working and paying the bills, trying to put food on the table, and they cannot be there when the child needs them. That does happen sometimes. So yes, those I think are that's a good word for it, sneakier ones that come up. But as the child grows up and starts to do their own emotional work, sometimes that includes becoming a parent, sometimes it doesn't, then there are wounds there that still need to be healed. They can even have compassion. Like I knew my parents were working and trying to provide a good life for me, and I have respect and compassion for that, but it's not what I needed.
Yeah.
I wish they would have worked a little less and been home in the afternoon or whatever that is that they needed.
So I think, what you're describing right now, Liz, is kind of helping us shift into my next question, which is, who is the inner child? And I feel that, there are, of course, depending on the theory, there are all these different ways of describing this part of ourselves. But for me, the inner child is that part of you that, when you think back to your childhood as to what you wished for and didn't get, or what you needed as a child, and maybe those needs weren't met. That's kind of what I think of in terms of the inner child. Or I also think of the inner child as that part of you that, for whatever reason, stopped expressing a certain aspect or stopped reaching for something. So maybe the part of you that maybe was open and welcoming to others that shut down because of something that happened in your childhood. So that part of you is no longer in the present moment.
Yes, I would agree with that. And there are lots of definitions of the inner child, but I see it as that part of yourself that if you think about a beautiful 5 or 6-year-old who's never had big trauma, right? Like never, and they're just on the playground, happy, playing, beautiful. There's this light that shines from them. They're so excited about life. And that's the inner child. That's the original being who has belief and trust and love. And none of that has been shut down yet by culture, society, parents, caretakers, school, like all of those influences that come in.
Yeah.
So that's how I see the inner child. It's that person. It's the original belief, original love, and original trust that it has. Like we're all born with that original trust and belief and love and need to connect with people.
Yeah, and not having the things that get in the way as an adult that keep you from connecting with others, from expressing yourself, from taking chances, from smiling, all of these things that we as adults maybe are more self-conscious about or just more cautious about showing or expressing.
Yes, absolutely. So I often say the inner child sometimes gets corrupted. I don't know if that's the right word for it, but
Right.
or it gets led astray, or it gets beat down, or it gets buried. It's some adults have an easier time accessing the inner child, and sometimes you'll see that when they're able to let go and play and even be with their own kids, or maybe they're out and having fun, and that's that inner child self that's coming out and just being who they are, versus it's much more difficult for some people to really access that. And that is often dependent on history. I mean, sometimes it's personality too, right?
Yeah, right. Absolutely.
But sometimes it's history that they lose touch and they lose sight of what their little self, quote unquote, needs and wants, and how to nurture that part of themselves.
In internal family systems, or it's also called IFS, or parts work, with the therapist who founded this was Richard Swartz. And in it, they talk about that inner child. They call it the self with a capital S, and that this part of you is exiled at some point in your childhood. And what happens are you have other parts that become protectors. So it can be anger, sadness, controlling behaviors, neediness, anxiety. And what happens are these other parts of you become the protectors. And so because they don't want this exiled child to be hurt again, what happens is anger is the one that is the one driving that bus, the one who's interacting with the world, or it's their controlling part, or it's their sad part. And so it's about getting beyond these parts that mean well, and that's the other thing about this. We tend to look at things like depression, anger, anxiety as inconveniences or negatives, or wish we didn't have them. But in internal family systems, we look at those parts as protectors. They're purposeful. They're there to keep you safe. So the anger is there to keep that child who was maybe bullied when they were younger, or that child who was abandoned or sexually abused. The anger keeps that child safe. So that's what you get when you interact with this child, is the anger. And so it's about how do we get the anger to begin to step back, and the inner child to be able to step forward more. And so it's not about getting rid of those parts, but not having them dominate the interactions.
Very interesting. I haven't read that particular system about it, but it completely makes sense. And I know in any hypnosis training I've been in, which is a lot because I go to conferences like twice a year now, we talk about the symptom, anxiety, depression, or even a prescribed symptom, let's say a fear of something, as protective.
Wow.
It is serving a function for that person.
Oh my gosh, it just goes together.
Yeah, absolutely, it does. Yes. And often part of the history taking is to say, what time did this start? Did anyone else in your family have the same symptom? Like, are they identifying with someone else in the family? It's this protected them, it's going to protect me. But it's always of utmost respect of that this symptom is serving a function for somebody in their life. It is protective and somehow. Wow. And part of the process of hypnosis is looking at that and saying, okay, you no longer need this symptom to help protect you. Let's develop some other tools to help protect you. Or you may already have the tools and you just don't need the symptom at all. But it's working with it that way on the unconscious level versus, you can't tell somebody, well, you don't really need that depression right now. Like, really doesn't work, right? That really doesn't work. I haven't been depressed myself. I know this.
Yeah.
But it's always protective. It's always a function. Yeah. And it doesn't always match with our current culture here. So I like to say, like, I wish we could go back 100 years to France and we could go convalesce somewhere, right? When we're depressed, like people would get sent off to get the cure, quote unquote, in some like spa with like healing waters somewhere. And they would go live in some place and be gone for several months. And then they would come back. And it's like, oh, wow, like we don't do that anymore. There's no avenue to do that. And what a perfect way to be depressed. Right? Like, let's go off and convalesce until we don't need it anymore. We're back to our regular selves. So Anyway, we got a little off track there.
No, it's
but
fine. It's
how I
interesting.
think of it.
When you ask the question of when did this part or, this way of being begin, was it from another family member? It makes me think of in parts work, we look at these parts as stuck in time. And so asking the person, let's say this behavior is one of giving up and shutting people out, asking, do you remember when this part of you first came to your, started to become very active? Do you remember when this part of you came alive? And they'll be able to usually say, well, I remember when I was 8 or when I was 10. And so really getting to a place where this part knows now that it's, 2017 and the person is safe. And
yes, exactly. Yeah. Yes. And it's amazing how people will have an age. Like they will often tell you.
They will.
Yeah, the first time this happened, I was 5. And they'll even tell you the scenario and all kinds of stuff. Or, sometimes it's older than that, whatever it is.
Yeah.
People generally know. So, yeah, it's a fascinating way to work with it.
So I know you've already started to share a little bit. So maybe shifting gears now. And how can hypnotherapy help a person to heal the inner child?
Yes. Okay. So I work with it a couple of different ways because often when you're talking about traumas with the big T, you can't work with it as directly at first. You really have to establish safety first and trust with the person. And like we said before, it's one of the big myths with hypnosis is that you come in and lay down and you get fixed, right? So it's developing that relationship at first with the person, and then through hypnosis, establishing a safe place for them. So that's true generally regardless of what we're working on. We want to establish a safe place first for the person to go to. And this can be a beautiful scene. It may be forest, it may be ocean, it may be a safe room where they feel nice and warm and cuddled up. They get to create that. So we talk about it with them and they create that. And this becomes a place that they could go to at any time, return to at any time during the hypnosis where they feel safe. So that's really the first step. Then we get into going back and looking at what does the inner child need? And we may go back in time to teenagehood. We may go back a little bit earlier to preteens. We may go back to the little bitty child. So they get to visualize the little child, let's say, and say, like, what does he or she look like? What colors does she like? How old is she? I'm going to say she just to make this simple, right? But it works just as well with men. What are they wearing? Where do they live? And we establish all of that and we talk about it a little bit. And then we also say, okay, what does she need that she's not getting? Or what would your adult self tell her or him? So sometimes they'll do imagery where they take the little child by the hand, where they hug them and they smooth their hair down and kiss their little cheeks, just like you would really showing affection to your own child who's right around, let's say 5 or 6, right? You just want to squeeze them a lot of the time.
Yeah.
So we go back and have them do that and give the inner child some of the affection and love that they needed and ask them, what do they need? And see if the adult self can give it to them. What kind of reassurance? Sometimes we'll do scenes that perhaps are traumatic and they get to replay the scenes and what did their child need at the time. Sometimes this is done from what we call displacement. So we use, particularly if there's been severe abuse going on, it's too threatening often for someone to see themselves and then see the parent giving them what they need. They just can't do it because it's like they can't imagine their parent that way. Like their parent wasn't that way and they would never be that way. And, this type of thing. So sometimes what we do is go back and have them imagine some other child who's very similar to them. So that's often easier.
Mm.
So you look at this child and her parents and what did they give her and what did she need at the time? And then you can work up to not like changing their own parent, but saying, what would you as a parent give your inner child? What would you give her that she needed that she didn't get at the time? So it's obviously really individual depending on how the person is reacting and wants to work on and do that stuff. But that is like a roadmap, an overall roadmap of how we get there.
Wow, it's really a beautiful process. As I was listening, I love that, as it should be, there's that emphasis on the safety, and you can't just go right to the pain,
Mm-hmm.
Yeah. And also it's very gentle, it's just as if you were working with a young child, there's a sense of safety, of being held and moving at a pace that is right for the client. So it just listening to you, I can see how this would be, so useful for people who need to heal from trauma.
Yes. Yes. It's always working at the pace of the client. So these are also not like marathon sessions, generally not in my practice. And you would never start with that. I don't know any hypnotherapist that would start with like a marathon session.
Right,
I mean, we're talking, start off like very gently, like 15, 20 minutes. Sometimes I start off with 10 minutes. Just let's create the safe place. And then as you get deeper into the work, you can go a little bit longer, or it depends on where the person is in the hypnosis. They can always stop it at any time. They can always come out of it, talk to you, go right back in. Some hypnotherapists work where the client talks to them the whole time, like they're asking questions the whole time. And it just depends on what they're working on. Sometimes I do that and sometimes I don't. But it's always like safety is always my primary concern there, that they feel emotionally safe and we go at the pace that's comfortable for them.
So for the clients between session, is part of the healing and the growth, or I guess laying down the new neural pathways that they're able to access these experiences that they have with the hypnosis between sessions, or when maybe they're struggling and are able to maybe reparent that wounded child or respond differently? Is that how the hypnosis gets integrated into the person's life?
Yeah, I would say yes. Like there's so much you can do outside of session. So a lot of what I've learned about the inner child is actually from ACA, which is Adult Children of Alcoholics and Dysfunctional Families. It's a 12-step program. And their whole focus is on the inner child. So those are free meetings that someone can go to and attend. I have other exercises that we do. There's before I started doing hypnosis with this, actually, I used to do this dialogue. I would assign clients a dialogue to do. And this dialogue comes from Journey from Abandonment to Healing by Susan Anderson. That's a book that she wrote. That's a wonderful, wonderful book. But she talks about the dialogue between big, which is your adult self, little, which is your child self, and outer, which is really the self that wants to act out. Right? She puts it at about 7 or 8 developmentally. But when I'm working with clients with this concept, sometimes that fits, or sometimes it fits for them right around the age of a preteen. Okay. So preteen, early teen. And when I read this book, I didn't actually know that it was considered a resource for borderline personality disorder, who I love to work with. And I only found that out 2 years later or something, right? But borderlines will tell you they have this self that wants to act out, that wants to go and do destructive things, that knows that they shouldn't, right? But does it anyway. And part of DBT, dialectical behavior therapy, part of the work with them, part of this work with them is emotional regulation. Like, how do we regulate that self that wants to act out? How do we get the feelings under control, go into our wise mind, quote unquote, and make better choices? So this dialogue fits in perfectly with that, because you actually write out, big would say, you'd put big, right? You put the the colon and you'd say, what do you need, little? And then you'd put little, put the colon, you'd say, I really need a hug. I'm feeling really out of control. I want to feel safe. And then Biggs can say, okay, well, I can give you a hug. I can do that for you. I can help you feel safe. And maybe Outer comes in and says, no, I don't think so. We're going out of the house. We're putting our heels on and we're going to go like kick some butt somewhere, right?
Right.
So Big says, and Little may say, that's really scary to me. Like, I don't want to do that. That's scary. And Big can come in and say, no, you're going to your room until you calm down and I'm going to take care of Little and this is all going to be okay. So that's a really tiny snippet of how someone could work with this at home with that dialogue. And what I recommend to clients is that they journal this. Like they do this exercise every day. I love handouts in my practice. So I send them home with a handout. And they journal it and they get a sense of it and they learn how to work with Outer to protect their little child, their inner child. That's who that really is. So that's one way I work with it. Another way I had one client who really, really had a hard time even doing the dialogue. She couldn't imagine a little child, none of this. So I sent her to a park to go listen to how do mothers talk to their kids at the park? Or what do kids say?
Yeah.
And of course you have to be careful with that. Right. It's easier to send like a 40-year-old woman to a park than a 40-year-old man to a park. Like,
right.
Honestly.
Right.
But my point there is, okay, you can watch a movie or you can go to the park or you can go to the mall and just sit in the food court and listen. How do people talk to their children? Get a sense of that. Get a sense of what a child really wants to do. Do they want to like jump out of their seat every couple of minutes, or are they, sitting really still, or who is that for you? So that's another way we work with it between sessions.
Wow, you can just see that there are so many ways to really take these hypnosis sessions and really begin to make some meaningful change and to heal.
Yes. And it is what I call it's a mixed treatment, right? So it's not just straight hypnosis. We're using hypnosis to help us get there, to help some of the healing piece, but there's all this work we're doing outside of the actual hypnotic trance as well.
So, Liz, if someone is listening and they're resonating with what we're talking about and they're interested in hypnotherapy for trauma, what are the steps you'd recommend for choosing a qualified professional?
I would definitely say to go on either the National Guild of Hypnotists or the ASH, which is American Society of Clinical Hypnosis. There's also the International Society of Clinical Hypnosis, if they're international, because I know podcasts get listened to all over the world, right?
Right, they do.
So, yes. So I would say find someone who's a licensed professional in your area to help you work with hypnosis for trauma in particular, because you want someone who's a licensed counselor or mental health therapist or psychologist, because they have the background to be able to handle the trauma and work with it in multiple ways versus, I would say don't go for someone who just has hypnosis certification and that's it. Right. They went to a school and just learned how to be a hypnotist. I would say look for someone who also has a background in treating trauma, period. So you can look at their websites or anything, but I would start at those big national organizations and then filter down to your area to see if you can find someone.
And Liz, what would you say are the gifts that you have seen people experience as a result of hypnotherapy?
The gifts.
Yeah.
I have seen incredible change. Like I still feel like hypnotherapy is a miracle. Like every time I do it.
Wow. You're so passionate. That's wonderful. I love it.
I feel like this is a miracle that just happened. I mean, sometimes it's a miracle after 5 sessions. Sometimes it's 3 sessions. I mean, someone came in for nightmares. She only needed 2 sessions. Wow. That was it.
Wow.
I was like, oh, and she was pregnant and having these awful nightmares every night. And it was like, oh my God, like that's a miracle. She doesn't have to suffer anymore.
Yeah.
So I did inner child hypnosis. Actually, one of the first times I did it, the woman just sat up and cried and said, "That was incredible. I've never been able to go back there." And she just felt like it was so healing.
Wow.
Because she took her inner child by the hand and really comforted her, and they walked off into the sunset somewhere,
Wow.
let's say. I don't remember exactly how it went, but she just felt like she had never been able to go back there. She had never been able to do that kind of healing, and it truly impacted her. So it does get very emotional during session, sometimes with the healing that happens.
Yeah. Liz, can you recommend any resources for those who are listening who might feel like this is resonating for them and they want to learn more? And also share how listeners can get in touch with you and find out more about you.
Sure, absolutely. The 2 books I talked about, so ACA, Adult Children of Alcoholics and Dysfunctional Families, there's generally meetings in most of the big cities and absolutely some of the smaller ones. So I recommend that as a resource. The Journey from Abandonment to Healing, it's a really good one. The Healing the Shame That Binds You, that's John Bradshaw, and he does excellent work in that book. He talks about the inner child and how to heal it, and he has some visualizations, some guided meditations that you could do in that book. So I really recommend that one as well. And then in terms of finding me, I'm in South Florida, if you want to come in for individual work. And my website is drlizhypnosis.com. So that's DRLIZ hypnosis.com. Or you can also always subscribe to my podcast, which is called Hypnotize Me. And it is all about hypnosis. I talk about all kinds of different topics and research, and also interview master hypnotherapists. So it's a really fun way to get to learn more about hypnosis.
It's a wonderful podcast, and I've learned so much from listening to your interviews and your solo episodes, and I recommend it highly to our listeners. And I also want to say that as of, I guess, a week or so ago, Hypnotize Me hit 10,000 downloads. So congratulations.
Thank you, and thanks for the compliment. It's just been a really incredible journey. I know you've talked about this with your own podcast about how it opens doors and these places in you that you don't really expect it to. And it's just been a wonderfully fun thing to do, as well as you get to learn all kinds of interesting stuff along the way.
You sure do. You really do. Liz, thank you so much for coming onto the podcast today and having this conversation with me. I know that this is going to resonate with so many listeners.
Great. It was my pleasure. I really, truly love and enjoy your podcast. So I'm so honored to be here.
Oh, thank you, Liz. That means a lot to me. Take care.
You too.
I hope you enjoyed today's conversation with Dr. Bonet. One of the aspects that stood out for me is how hypnosis helps create change by supporting the growth and strengthening of neural pathways. Another aspect that stood out for me is that while hypnosis is not a miracle cure or an instant cure, it can work fairly quickly in beginning to create change and alleviate symptoms for the individual. For show notes to today's episode, visit www.lourdesviado.com/women in depth, where you will find links to the resources mentioned. I encourage you to check out Dr. Bonet's website. She has a ton of useful and free material available, as well as access to her amazing podcast, Hypnotize Me. And if you enjoyed today's episode, please subscribe on iTunes or share with a friend. Again, thank you so much for listening, and see you next time.